The top 9 causes of neck and back are poor posture, be it sitting at home, sitting at the office, sleeping at night, watching television, walking, or carrying your purse or heavy bags or grocery shopping. Your spine is an armor. An armor, as I said, that houses your nervous system. And that armor is the body's lifeline. But when you sit in an awkward posture, not only does that affect your neck, but also impacts your heart and lungs and your intestines. And we'll cover those in just a moment. According to published data out there, neck pain impacts 70% of the people, at least once in their lifetime. And back pain impacts people 80% of the time, at least once in their lifetime. But that statistic is changing. The number one reason why there is such a dramatic rise in the epidemic of neck and back is mainly because of our sedentary lifestyles and our habits, our sitting habits, especially at work. For example, let's say you sit in a bad posture. Yes, your neck is stressed, your back is stressed, the curvatures are not there. You're not happy, tension is felt up here. Now, to better understand that, I like everybody to kind of slouch, just sit in a worst possible position you can. Let me, like something like this. Now, this position, feel your stomach. It's getting squeezed. Your stomach sits here. You got your intestines, your kidneys, your bladder, your liver, your pancreas. All of that, organs in here, they're getting squeezed upward. Guess what's above that? Your lungs, your heart, everything is getting squeezed. You do this every day. You think your lung, your stomach, your intestines, all of that will be doing good? So, yes, and technically speaking, bad posture is a killer. And they've said now that sitting is as bad as smoking. So when you sit upright, your stomach feels better. And when you sit, you have to make sure, let me step away from you guys, that your knees and your hips are in line or just slightly above, that the back of your knee does not touch the back of the chair, and that your feet is directly under your knee. These are critical. And you have to look straight ahead. Be it sitting in an office, in a meeting, or as much as you can, get in these habits now. As I said earlier, 2 things are most critical: posture and sleep. You master those, you beat dementia, Alzheimer's, cancer. Yes, those are the top 3 problems for men and women when we get into our 70s, 80s, and 90s. Sleep is the important one. Now, when you sleep, of course, you want to make sure that you sleep at least 6 hours. If you wake up frequently, then you have to make sure that is expanded, but do not shortchange and say, I will take a nap in the afternoon. That will aid you. Even if you watch your posture, that will aid you fast. Not just your body, your heart, your lungs, your liver, your kidneys, but also your mind and your nervous system. Everything dies when you don't get enough sleep because the body regenerates when you sleep. Well, because during sleep, the body's ability to regenerate itself is significantly higher than it is when you're awake. Number 1 position. The best side to sleep on is the right side. That's for overall health. The second best position is on your left side. These are all best positions, not saying that the third one is the worst one. The top 3, the top best ones. And the third best is on your back with a bolster under your knee. When you sleep on your side, it doesn't mean you sleep like this. You gotta sleep with a nice pillow, keeping your spine straight, not bent like so. Do not have your knees like this. You wanna have a bolster between your knees. So that way, the spine is kept neutral. Because when you sleep on your right side, the brain functions better in the morning. For some of you, sleeping on the right side may cause stomach issues, heartburn. It's like, what if I sleep on the heart, my GERD? So then sleep on your left side. But one of the things that they mentioned that could be, that's not just for the mind, but also for the heart and lungs, is that you have two lungs. And 99.9% of us have our heart on the left side. Okay. If the heart is on the left side, that means that the left lung is smaller because the heart is coming through there, right? The right lung is actually the heavier one. So if you sleep on your right side, the left lung is coming down on top of the heart, the lighter lung. So it's also better for your heart. So we discussed posture during wake hours, sitting, and posture during sleep. These two things you guys have to do immediately. But a third one is posture when you're standing and walking around. Do not walk or stand like this lady in the front. Head down like this, like so. Shoulders drooped and forward. Stresses the neck, stresses the back. Stand as tall as you can. And make it a habit. Every time you stand, suck in your stomach. Your belly button. Try to suck it in towards the spine. That gives you an upright posture. That also contracts the abdominal muscles, which is one of the most important core muscles you have. It tones them on a regular basis, and especially when you walk. So bring the navel, the belly button towards your spine, head and neck, chest out, walk, stand, whatever you do. Equal weights. When you stand still, do not lock your knee. What I mean by that, stand like this, natural, but don't do this. Don't kick your knees back, because you will destroy your knees in time. Now, that is for standing posture. Now, strengthening and exercise is core to every recovery, whether you have muscle issues or you're not having any muscle issues. Why? Because we said all day long we get into poor postures. If our muscles are strong, we will be able to withstand those stresses that we from time to time or on a daily basis that we put on them. Yes, we need to exercise. But exercise should only be done if your body is strong enough to withstand it. So we're going to go over some exercises and why you do them. And if I do show you some exercises, please don't do them at home. Please clarify these that I show with your healthcare provider before you do them. Now, let's say for those who have neck issues, and the most common problem for people who have neck issues, neck pain, neck stiffness, is this type of a posture, which is an upper cross syndrome. And the best exercise for that is the WTL, the WYTL. Basically, the letters dictate the position of your arms to the rest of your body. Okay? The W is getting to the W position. When I have patients do the W, they do this, lifting up the shoulders. This is not the right W. You have to push the shoulders down. This has to come down. Shoulder blades squeezed in. Chest popped out. And hold, contract. Hold 5 to 10 seconds. The purpose of all of these exercises is to strengthen here. In about 3 to 5 days, we have a video on this. Listen to your body. Don't ignore it. Don't tell it to shut up. So when you do this, squeeze, hold, 3 seconds. If you're okay, next time you can do it 5 seconds, 10 seconds. How many reps? 5 to 15. You pick. Progressively increasing. Next one is the Y. You form a Y with your arms. Again, same. Keep your shoulders down. Squeeze the shoulder blade. All of these is targeting your rhomboids muscles. The rhomboids are the muscles that connect. I forgot I have my buddy here. These muscles, the rhomboid connects between the shoulder blade and the spine. We want to strengthen these. And there's also the trapezius muscles that connects all the way down here. It's a triangular muscle. All of this contraction helps this. When it helps this, when your shoulder blades come closer, you no longer go like this. So if you kind of walk around like this, that means this muscle is weak. The next exercise after this would be the one for your lower back. Okay, you got, and also the neck, because then you can do the dead bug exercises that is shown in here. Laying on your back, arms and legs, opposite arm, opposite leg. It exercises your upper extremity, your spine, and also your legs and your core and extensor muscle. Wonderful exercise. Yes, it's simple. But once you start to improve, your body gets stronger, then you can add weight. Small wrist weights, leg weights, increase progressively. But again, don't do until you've clarified with someone. Then the other exercise is, of course, the core canister exercise, the one that we talked earlier, showing the lady, you suck in the navel. Standing, exhale, pull in, contract until it's in, and you hold that. You do it vigorously, but not if you have intestinal issues. Make sure you check with whoever your healthcare is. You do this a few times, you have no issues, and you want to move it to the next level, can. You do a more aggressive form of the same thing. This is for this muscles here. Again, same as the core canister contractions. This time, it's harder because gravity comes into effect. Get into this position. Let the stomach fall towards the floor. Contract, suck it in, hold it. Hold it for 5 seconds, 10 seconds, 3 seconds, however long you can, and repeat. That will improve this. And at the same time, the process of sucking the stomach in also gives you a mini Kegel exercise at the same time. It helps improve the pelvic floor muscle and also the canister muscles. Exercises you must do. If you're a person that I'm seeing, all of you that are my patients can start the Kegel exercises right away. You have to have lifestyle changes. You got to change your lifestyle. And the best time to do it is when you're hurting. Because when you're feeling better, you're not going to change anything. Okay, well, I thank you very much for coming. I welcome all of you to come to any of my talks. You want to come to the same one 15 times? Come 15 times. Sometimes we need to hear it over again. I will do whatever I can. I wish I could spend this much time with each and every single patient, but if I do that, then I'll only see one patient a day.